Alrighty.
Hi, Tom. How are you?
Hey, Senait, how are you?
I'm good. I'm good. So let's start this discussion about the clean cut. Congratulations that we have now published our study. So let me introduce myself for our viewers. My name is Senait Bitew, and I have been the program manager for Clean Cut and Lifebox in Ethiopia. And I would love Tom Weiser to introduce himself as well. Please go ahead, Tom.
I'm Tom Weiser. I'm a general surgeon from Stanford University, and I've been the PI and leading the Clean Cut program in terms of its development and overall direction. So,
Okay. Thank you. So can you just give us what CleanCut is for those who are not familiar about the CleanCut project? Can you give us a highlight?
of course, so Clean Cut is a team-centered, checklist-based intervention that focuses on reducing surgical infections by improving teamwork and compliance with best practices around perioperative infection prevention and control. It's a multimodal adaptive type of intervention, and it really focuses on six core standards around surgery prevention, about infection prevention, focusing on the appropriate preparation of the skin, the maintenance of a sterile field, the appropriate timing and selection of antibiotics prior to surgery, the assurance of instrument sterility, the routine counting of swab and gauze counts, and then the use of the checklist to improve teamwork and communication. And focusing on those six compliance items, we were hoping to really reduce surgical infections.
So thank you, Tom, for giving us a little bit of what this project was and how the program was started. Can you also put a context what surgical site infection is and what is the scale of a problem? Why CleanCut to tackle these issues?
Absolutely. So, surgical infections are a major cause of morbidity and mortality in surgical patients, probably the major cause. I think the things that kill surgical patients essentially are bleeding and infection. Those are probably the two biggest things. And um, one of the issues is that we know that there are opportunities to reduce surgical infections by being incredibly compliant with best practices and deliver quality at a really really high standard. We know in settings across the world, both
Mm.
in rich and poor countries, that these standards can be very variably applied. And so our goal with CleanCut was really to highlight a couple of the core factors around infection prevention and surgery, and make sure that for every patient, those are done every single time.
Yeah, thank you. I mean, even in Ethiopia, as we all know, the surgical site infection rate has been very high with all the hospitals that we have been working and implementing the project. So the paper that has been published in the BJS, the British Journal of Surgery, which is the title, it has the Clean Cuts Adaptive Multimodal Surgical Infection Prevention Program for Low Resource Settings, a Perspective of Quality Improvement Study. What are the key messages that the result has now, and what does it show us, and what impacts has Clean Cut shown to have in this paper?
Yeah, so one of the reasons that we focused on lower resource settings is we know that
Mm-hmm.
actually surgical infections happen at much higher rates in low resource settings. There's a number of combinations and a number of reasons for that. So one is late presentation, the types of conditions that patients present with. But we also know that there are organizational and management challenges in some low resource settings that are really particularly amenable to an intervention. What we found was that when we introduced our program and we built a team and we really improved compliance with best practices, we noted that we had dramatic improvements in compliance with
Mm-hmm.
some of these practices that we had mentioned, those six standards that we had set out in the beginning. We had dramatic improvement across all the standards. The ability to
Mm-hmm.
comply with all of them and at a single patient at a single time went up quite a bit. And in doing and improving that compliance, we were also able to reduce surgical infections.
Yep.
You asked a little bit about the results specifically. And so a couple of particular results stood out to me. So one is that after implementation of the program, we were able to reduce the relative risk of surgical infection by almost 35%. So that there was a so essentially that means a
Which is
35% lower likelihood of infection in those patients that
mm,
were having operations after implementation of the program. So in regarding the second point of the findings, what we did notice was that when we compared those patients who had low compliance with those standards versus patients with high compliance to the standards, those patients with high compliance to the standards had a 46% lower likelihood or lower risk of infection, meaning that we
mm,
know that good compliance with these infection prevention practices results in lower risk of infection. And those
awesome.
are and those are those things are done mostly because of good practices of good compliance, not because of high resource intensity or added capital equipment, which is a really important point, especially in resource constrained settings.
True. I mean, for even if you ask me as a program manager, that the impacts that I have seen implementing CleanCut project is, it is beyond the numbers. It has a great impact on bringing the team together that we have been working, the surgeons, nurses, anesthesia providers, even beyond that, the managers and hospital administrators. It has been a great gluing effect that the CleanCut program had as a program itself, and also for all of the team to show what the surgical safety checklist can bring to the patient safety. The how do you say this? The satisfaction rate of, even not just for the patients, for the health providers, how the nurses were felt when they call back and ask their patients on how they're doing, if they had any infection or those questions. It had a great impact that we all have been so proud about. So as an next question, if I mean, it has been now how many years we have been implementing CleanCut, and then all the challenges we have faced, and what are those specific challenges that you want to put out here?
Yeah, obviously, and you know well, Sanaya, the
Mm-hmm.
challenges are really one around organization, getting folks together in the same room, and then to understand what it
Hmm.
means to work as a team, what it means to take advantage of each individual person's
Yeah.
capacities and expertise. I think, in surgery and anesthesia and nursing, we all are used to working in our little silos in our disciplines, and trying to break those down is incredibly
Mm-hmm.
challenging. Um, and we do it in a setting where everyone is overworked. Everyone has, multiple
Yeah.
jobs and fills in multiple roles. Um, and to add, an additional burden of a program like this it's a lot to ask. In fact, maybe I'll ask you tonight, since you've seen across multiple hospitals and
Yeah.
multiple hospitals, multiple attempts at getting the programs up and running and then keeping them maintained. You know, Tell
Yeah.
me a bit about your experience as
Yeah.
the challenges you face when you first approach a hospital
Yeah.
with a program like this. It's not always the easiest thing to sell. So I'm just, you were able to do
True.
it. So tell us
True.
about that.
True. So I mean, it is, it has been challenging in a way, but also the health professionals, the hospital administrators, once you have convinced them, and once they understand the whole objective of a project, it was easier. But then most of the challenges are around the administrative management issues, because this is quality, and it is not only, I mean, you don't produce results in a day or in a week, even after 6 months that we have stayed in a hospital. So it was a teamwork that we needed to bring to these hospitals that we have worked with, and the team. I mean, everywhere in the world, because I have been now travel with Clean Cut Project, even traveled to the African countries, Uganda, Rwanda, and then we have heard a lot of stories about how teamwork has been a challenge, even in the US and UK. So this is not just for Ethiopia, but all over the world. Teamwork in the OR arena is not something that we brag about. And then we still have a challenge. But with all those challenges, with all those pushbacks from some of the hospitals, but there was a huge, I would say, the challenge were not that much for us not to continue the Clean Cut project, or the support was a huge success than the challenges. So yeah, this was my take actually.
It's interesting because you say that because
Yeah,
as we noted, each individual hospital had improvements in compliance, but no individual hospital necessarily showed statistically significant reductions in infections. It was really in aggregate. So
yeah,
in study it was just over 2,000 patients across these 5 hospitals, but yet each individual hospital is going to face separate challenges. I'm just curious as to how when you ran into a challenge at a hospital, you don't have to name anything, but just give an example of how you helped or guided or mentored some of these hospitals and teams to address their own problems, right? The idea is that they're supposed to
yeah.
figure out their own solutions, and our role really is just to facilitate that. So,
True.
tell me a little bit about that.
True. So, implementing the project, as you said, the hospitals had their own challenge. Having a different size of staff, a different size of surgical volume, a different size of whatever this specialties and all. Uh, but one thing that we have always kept going on and kept doing was having a meeting with the administrative staffs, with the management, so that it is not imposing the project, but it is together that we can work. Otherwise, the clinicians and the administrative, the management staff, if they cannot talk, if they cannot discuss and try to solve their issues, we go nowhere. So specific to hospitals, it is pretty much, it is the extent of the challenge that might differ. Otherwise, most of the hospitals have the same issues, bigger or smaller number of surgeries they have. It is fascinating that you see the same challenge a huge hospital has to a smaller one. And that gets you like, okay, does this has to happen? Or it should have been easier in the lower surgical rate hospitals, but then it was somehow similar. But yeah, as I said, we have been so close to the management and the administrative team. We have been so close to the clinicians, as our job was facilitating the discussion, the teamwork, the leadership between these two. I believe it has worked a lot, and it paid off with the result that we have now.
May I ask you one question? How essential or not was the support of the ministry? So, the ministry obviously, actually, why don't you tell us a little bit about the ministry, the SALTS program,
Yeah.
and then how and the role that the ministry played, if any, in terms of of supporting this kind of
Yeah.
work.
It would have been very hard if it was not for the ministry support as well. The role the ministry had played includes selecting the hospitals that we work with, and also following up all the steps that we take in every step as we implement clean cuts, phase by phase. In every step, we include them in our meetings, we include them in our group chats that we have Telegram in Ethiopia, and we have some of the SALS team members in that channels, so that they can see where we are heading, what is the challenge, what are the challenges, how the hospitals are being engaged, and all. So the SALS project, in first off, if it was not for the SALS project, CleanCut wouldn't have been here, and also as a quality improvement project, the ministry, the sector by itself, the department by itself is heading towards quality, because we have had a lot of issues with quantity, with quality, and all the quarrels that have been going on. So it is with the support of a ministry, specifically to the Department of Quality Improvement and the SALS team, that we have had a lot of back and forth with the hospitals, even with the challenge with those hospitals that we did not succeed a lot documenting or taking data. It was still with the involvement of the ministry. So the ministry they had a lot of things to do. They have many projects that they have to follow. But again, this is a quality improvement project. They have been pushing us, and they have been telling us even to take more hospitals, like 28 in a year. I mean, yeah.
And just for the listeners, tell us about salts. What is salts?
SALS is the Saving Lives Through Safe Surgery initiative, which was taken by the Ministry of Health in 2016. And that means the ministry had already pledged or accepted this challenge of the surgical arena, the surgical site infection rate being high, the surgical volume being low, the waiting list of surgeries being very high in almost every hospital in the country. So there has been an initiative to tackle all these challenges the country was facing. So in 2016, the document was produced. Now it is in its revision. So that's what SALS is.
No, I think listen, at the end of the day, this is kind of it is a labor of love. It's a big investment of time and energy,
Yeah.
but it's also something that I think reaps rewards that go beyond just the outcomes, the patient outcomes, as you said. I think there are a lot of very positive gains that the surgeons, the anesthetists, the nurses get from developing a more cohesive ability to work together, from working as a team, and from helping, from going from an entire process from identifying a problem to identifying a number of different solutions to implementing those solutions and then seeing the effects of that improvement over time. And those are things that they all can take ownership of and also feel pride in having accomplished. And our role really is maybe one of being a catalyst or being a facilitator, but not one of making the work get done. Ours is really ensuring that all those providers and those teams are able to see a way to make improvements in their own setting, even when they're incredibly challenged, as you say, by the overwhelming volume, by the overwhelming clinical need,
Yeah.
by a lot of the resource constraints, and yet they're still able to make really dramatic improvements.
True. True. Thank you, Tom.
Thank you, Senait. Listen, it's always a pleasure.
It was a pleasure too.
Absolutely.